So these are the legal age definitions, that, like definition of child, minimum age of marriage, responsibility of crime, juvenile crime, compulsory free education. So remember, number one, very basic, if you talk about, then what is definition of child? Anyone who is less than 18 years. Anyone who is less than 18 years, that is known as child. Now, because naturally OP Ghai 10th edition, latest edition also says that pedia means child and pediatrics means healer, and pediatrics basically cover till 18 years of life. In various government setups, we have in Hindura hospital, in our some hospital, you have till 12 years we take in pediatrics. In Lady Harding Medical College, till 14 years they take in pediatrics. But according to proper book definitions, till 18 years is pediatrics, and more than 18 years will go to medicine unit. What is the minimum age for marriage? The minimum age for marriage for boys, it is less than 21 years and for girls it is less than 18 years. So boys less than 21 years and girls less than 18 years. The minimum age for marriage for boys 21 and 18. So naturally 18 remember that way, because less than 18 years is child, and 18 years the minimum age for marriage for girls is less than 18 years and boys is less than 21 years. Responsibility of crime. Responsibility of crime, like we'll say, like 12 years. 12 years is a cutoff where I can say this guy, this patient, like this child is responsible for crime. Juvenile crime, juvenile as the word says, same 12 to 18 years is juvenile crime. And compulsory free education government gives from 6 to 14 years. 6 to 14 years they give compulsory free education. Whatever we are reading this for the first and last time. Okay, just read in that way that you're reading this for the first and last time, and you will always remember. So let's revise again. What is the definition of child? Less than 18 years is a child, and for girls also marriage cutoff is less than 18 years is a minimum age for marriage for girls, and less than 21 years is minimum age marriage for boys. And what you call responsibility of crime, 12 years I can say this guy is responsible for crime, and 12 to 18 years that is known as juvenile crime or juvenile criminal. And the compulsory free education, the government setup, government yojana, they give 6 to 14 years of babies, they give compulsory free education. Now, after legal definition, little bit on anthro, and then we talk about micro and macrocephaly. So yes, this is like a extremely important part, in our rounds also daily in hospital, we ask these questions. What is the normal weight? What is the normal formula? There are so many things over here. Let's go one by one. Okay, let's go the height first. So who will tell me what is the normal length of a newborn baby? The normal length of a newborn baby is around 48 to 50 centimeter. That is the normal length of a newborn baby. Okay. Now, I see, and we'll take one number. Okay, the normal length of a baby newborn is 50 centimeter. So remember always, length doubles by 4 years and triples by 12 years. Length doubles by 4 years and triples by 12 years. That means if a newborn baby is, I told you just now, the normal length of a newborn is 50 centimeter. At 4 years he will be 100 centimeter. The height of a 4-year-old is 100 centimeter, and height of a 12-year-old is 150 centimeter. So straight away, two questions I've already covered, that length doubles by 4 years and triples by 12 years. So 50, 100 and 150. Normal length of a newborn 50 centimeter, 4-year-old is 100 centimeter, and 12-year-old is 150 centimeter. Number one. Number two, next important point, after 50, 100 and 150, two more numbers remember, 75 and 90. 75 and 90. That 1 year old is 75 centimeter and 2 year old is 90 centimeter. In the INICT paper also they had asked this question. So 75 and 90, two words again I will remember. So 50, then 75, then 90, then 100, then 150. I'll repeat again for the last time. The normal length of a newborn baby is 50 centimeter. 1 year old is 75 centimeter. 2 year old is 90 centimeter. 4 year old is 100 centimeter. And 12-year old is 150 centimeter. Okay. So these are the important points you should know. Number one. Number two, very importantly, from 2 to 12 years, to calculate the expected height of 2 to 12 years, we have a formula that is age into 6 plus 77. This they're going to ask you in your pediatric residency also. Okay, all these formulas are really important. So very basics, very basics. You can't do bad things in basics, okay? So I'll repeat again the expected height formula for 2 to 12 years. It is age into 6 plus 77. Age into 6 plus 77. So this is the expected formula to calculate the expected height of a baby from 2 year to 12 year. So that finishes one point, that height doubles by 4 years and triples by 12 years. Done. Now coming to the weight, let's talk about the weight formulas. Okay, so we have this, yes, for calculating the expected weight, to calculate the expected weight of the baby, we have a proper formula that is known as the Veach formula. Now expected weight, to calculate the expected weight, we have very importantly, you can say 3 months to 1 year, 1 year to 6 year, and 6 year to 12 year. Okay, to calculate the expected weight of a baby from 6 to 12 years, the formula is 7x minus 5 by 2. 7x minus 5 by 2 is the formula to calculate the expected weight of a baby from 6 year to 12 year. For example, x is age in years. Okay, for example, if I say 7-year-old, what is the normal weight of a 7-year-old? So you'll do 7 into 7, 49, minus 5 divided by 2. Like that, you will calculate. From 1 to 6 year, we have a formula 2x plus 8. 2x plus 8 is the formula to calculate expected weight of a 1 to 6 year. For example, if I have a 2-year-old baby, so what is the expected weight of a 2-year-old baby? X is age in years. So 2 into 2 plus 8. So that means 2 into 2 plus 4, 4 plus 8. So that is 12 kg, like that. So expected weight of a 2-year-old is 12 kg. Did you understand? Number one. From 3 months to 1 year, we have a formula 9 plus x upon 2. 9 plus x upon 2. Now, this is 3 months to 12 months. So, this x will be according to months. X is age in months. For example, if I have a 9-month-old baby, what is the expected weight of a 9-month-old baby? So, 9 plus 9 divided by 2. So, 18 divided by 2. So, that will be 9. So, the normal weight of a 9-month-old baby is 9 kg. The normal weight of a 2-year-old baby will be 12 kg. And here we had calculated the normal weight of a 7-year-old. So it's a very beautiful way of describing and telling it to the point. This is really very important and very nice that you should know. And what else? Yeah. So this is the formulas. Now to have a shortcut, remember one thing. Okay. What is the weight of, remember, okay, a simple thing. Remember 9 9. What I wanted to remember in exam, that is 9 9. What is 9 9? The expected weight of a 9-month-old baby is 9 kg. If you can see, 9-month-old baby is 9 kg. This is like a very randomly. If you don't know this formula, if you don't know these three formula, just remember the 9 9. 9 महीने के बच्चे का वजन 9 किलो होता है. The expected weight of a 9-month-old baby is 9 kg. So 199 random formula you should remember. One more thing you should remember, that 1-year-old is 10 kg. Like always, forever remember, 1-year-old is around 10 kg. Why should I remember 1-year-old is 10 kg? Because as the age increases, as the age increases, the weight increases in even numbers. As the age increases, the weight increases in even numbers as in 10, 12, 14, 16, and 18. Being pediatric resident, you are very busy. You don't have remember the formula. So today also in my rounds, my DNBs and MD don't remember the formula because there's so much to study and stuff like that. That is why I roughly remember in OPD, 2-year-old baby comes. So the expected weight of a 2-year-old is 12 kg, 1-year-old is 10 kg, 2-year-old 12 kg, 3-year-old 14 kg, 4-year-old 16 kg. So 1, 2, 3, 4, 5, 10, 12, 14, 16, 18. This is something very randomly must appreciate for the exam purpose. Okay, so this is important. This is very important. Okay, number one. So which formula, age, everything I told you, formulas told you, everything I've told you, height formula I told you. Acha, this now we can do. So after knowing the expected weight, and it's one more thing also, which so weight. So what is the normal weight of a newborn? The normal weight of a newborn is 2.5 to 4 kg. The normal weight of a newborn is 2.5 to 4 kg, right? So when does weight doubles? This also they ask in exam. When does weight doubles and when does weight triples? In the previous slide, we had spoken that height or length doubles by 4 years and triples by 12 years. Whereas weight doubles by 5 months and triples by 1 year. weight doubles by 5 months and triples by 1 year. So this is something you should know for the exam purpose. For example, if a 2.5 kg baby has born, after 5 months he will be 5 kg. Okay, and after like 1 year he will be 7.5 kg. So whatever whatever that weight is there of that birth, so that doubles up by 5 months, triples by 1 year, 4 times by 2 years, 4 times by 2 years, and 5 times by 5 years, 5 times by 3 years. So slowly, one, you have to increase. I'll say it again for the last time. Weight doubles by 5 months, triples by 1 year, 4 times by 2 years, and 5 times by 3 years. So why so much of talking like that? Because this was the exam question. Weight doubles, like weight becomes 5 times from the birth weight by how many years? Baby's weight becomes 5 times from the birth weight by how many years? The answer is 3 years. Like that they had asked this question, so it's quite interesting that you should know. Okay, so this part is done. Now a little about elaboratively, as this is a elaboratively class. So I told you weight doubles by 5 months, triples by 1 year, 4 times by 2 years, 5 times by 3 years, and 6 times by 5 years, 7 times by 7 years, and 10 times by 10 years. But if you remember till 5 years also, that is enough, because this was the exam question. So it's pretty sorted out that way. Okay. Yes, we all know this question. Newborn baby, 2.5 kg. After fifth, like 5 days of the baby is born, there is a weight loss, 2.5 to 2.2. Now, how do you approach this case? So my HOD used to say, common things are common and rare things are rare. So what is that common things? So it's a physiological weight loss. As we know, the mnemonic, that is T, T, and T. That is term baby. He will have a 10% of weight loss in the beginning 10 days of the life, and on the 10th day the baby regains the weight. Okay, on the 10th day the baby will have a regain in the weight. Okay, a term baby will lose 10% of body weight in the beginning 10 days, and by 10th day the baby regains the weight. So this is known as like a physiological weight loss. This is the physiological weight loss because of the extra renal losses, extracellular renal losses. This basically happens. So that's it. 2.5 kg becomes 2.2. So how do you approach this case? The answer is conservative management, because this is normal. So conservative treatment is the best answer for this question. And at the same time, remember that a preterm baby is going to have a 15% of weight loss. Preterm baby is going to have a 15% of weight loss. And by 15th day onwards, the baby is going to regain the weight. Term baby will start regaining the weight after 10th day onwards, but this fellow preterm will have regained the weight after 15th day onwards. So this part we have done, we have spoken about it. This was a DNB question. I told you the normal length of a newborn baby is 50 centimeter, and I told you 1 year old is 75 centimeter. I told you, right? So from 50 to 75, there is a 50% increment. From 50 to 75, there is 50% of increment. So 50% of 50 is nothing but 25 centimeter, right? So 50 plus 25 is 75 centimeter. So this is like a one liner. You should know that length increases by 50 centimeter from the birth length by first year of life. That you should know. Okay. So this is also very interesting question. Everyone knows the normal height or normal length of a newborn is around 50 centimeter, but none of us knows in inches. This also had come in nursing paper also, so we should know that the normal length of a baby at birth is basically in inches. If I talk about, it is 19 to 21 inches. This is quite interesting, none of us knew. So it's like, so 50 centimeter is, at birth, so roughly half of that is 25, so around 21 inches. So 19 to 21 inches is the normal length of a baby, not height, but we'd rather say length, sounds better. But it's okay if they are saying height, but length is a better thought process. Okay, what is the expected height in the first year of life if the birth length was 50 centimeter? If the birth length was 50 centimeter, then the expected increment of the height by 1 year is around 50% increment of the height. So that is what we spoke about it. This was a DNB paper question, so you should know that. What is the expected weight of a 2-year-old? So it's very important to understand the MCQs. Theory plus MCQ. Theory plus both should be happy. The topic will be beautifully covered then only when you know the theory and the MCQ at the same time. So what is the normal weight of a 2-year-old? In your busy OPD, always 2-year-old, 4-year-old, 5-year-old. Every time the mother or father has one same question. Doctor, वजन तो ठीक बढ़ रहा है ना इसका. Doctor, is the baby weight fine or not? So if the baby is 5-year-old, so 1, 2, 3, 4, 5, 10, 12, 14, 16, 18. Okay, 5-year-old is 18 kg. Okay, fine. Like that. That time in OPD, you will not learn the Weeks formula, right? So that's why 1, 2, 3, 4, 5, 10, 12, 14, 16, 18 sounds a very beautiful logical point. So definitely 2-year-old is 12 kg. Done. Next question. Yeah, normal growth instruments sounds a beautiful point. So the normal growth instruments to take measure the length of a baby, we use an instrument known as infantometer. And to measure the height of a baby, we use an instrument known as stadiometer, right? This is very basic. What is the normal head circumference of a newborn? It's around 35 centimeter or 33 to 35 centimeter. To measure the skin fold thickness of a baby, we use a caliper known as Herpenden caliper. That is known as Herpenden caliper. So these are straightforward important question, must appreciate for the exam purpose. Infantometer is for the length, stadiometer is for the height, head circumference 35 centimeter, and skin fold thickness, you take it by Herpenden caliper. Now the videos will see. So, and remember, if you're taking the head circumference of a baby, obviously you'll take a non-stretchable measuring tape, and you're gonna have a overlapping technique. You will not cut, you will not measure the inch tape like just stuck like that, like just center to center. No, you will overlap it and you will minus it. Overlap 32 minus 2, something like that. Overlap technique is something you should know. And the book has written that you should measure it for 3 times and then take an average of that. None of us does that, but if examiner ask you, then say we usually take it for 3 times and take an average of that. Reference Piyush Gupta Clinicals, Lakshmana Swami have written that. Okay, this is also very interesting question. Identify the instrument. So this is my hand only. I was doing my SRship in LHMC. So there it was there. So yes, definitely this one. Yes. Now in front of you, this instrument, this. So what is the name of this instrument? So this instrument, very importantly, this is known as infantometer. This is known as infantometer. Infantometer. Now this one part basically it is stagnant, whereas this part is movable. You're gonna put the head of the baby at the stagnant part and the foot of the baby at the movable part. Because this one, the whole length is 50 centimeter, but you never know if the baby is bigger than that, right? So are you understanding? So that is why this part you can, this black part basically, you can stretch it. You can stretch it also. बच्चा अगर बड़ा है तो उसको नीचे भी किया जा सकता है. If the baby is bigger, then this part can be stretchable. So these are the inch tape one. This pink one is there and the white one is there. So basically white one, roughly it will be 50 centimeter. If the child is bigger than that, then automatically this part you're going to stretch it, and then automatically you will understand, you will take the length of the baby. Once you do the hands on, you will understand how to take. So one part is stagnant, one part is movable. This is an infantometer, and this is used to take the length of the baby. And if the baby is bigger, then automatically this inchite, basically the pink part, it will be helpful for you. This part is there, no? So one is this white part, okay, and one is this pink part. That's what. So two parts are there where basically all the measurements 48, 50, 52, 54, 55, it is written like that.